clearly we had 4 people who had coronavirus early on, and remind the community that those 4 people were well cared for at Westmead Hospital, and each one of those eventually was discharged from hospital. Overall in Australia, of course, we've had 23 people who've had coronavirus. 15 were the original group, if you like, when it was becoming apparent that coronavirus was a growing issue, and 8, of course, from the Diamond Princess. Now, as we're progressing, what we're seeing, we've been doing a lot of work to make sure that our state, and indeed working with all states and territories and the federal government, to ensuring that as far as possible, Australian citizens were kept safe through the various containment policies that have been appropriate for the period up to date. And of course, since the 2nd of February here in Sydney, we've had about 21,000 people now who have been screened at our airport. And of those 21,000 people, 67 were referred for pathology testing. And as I've indicated earlier, we've had a very successful period where there has been no transmission on our soil, on Australian soil at all, not just here in New South Wales. There's been no transmission from person to person. But it is becoming apparent that the numbers of people with the coronavirus across the world are increasing in a broader geographical region. The fact that there are now cases occurring in places like South Korea, like Iran, like Italy, does suggest to the governments here in Australia, and particularly the New South Wales government, that we need to be extremely aware of the increasing likelihood of a problem arising such that we would possibly declare a pandemic. But at this point, that is not absolute. What is absolute is that we need to be asking the community in every way, the business community, the broader community, to be doing what is necessary to ensure that a virus such as coronavirus is not given an opportunity to extend itself through our community by us failing to do what we should do. Now, we're all very aware. We remember SARS, we remember MERS, we remember swine flu, H1N1, and we know that if we take appropriate steps, basic steps, such as hand washing, such as sneezing into our elbows, and ensuring that we are keeping ourselves and our families and our community safe, that we can do a lot individually. I would strongly be urging the community to realise that they have a role. They have a role to ensure that they do what they've always done when we have the peak flu season. You know, in the next few weeks, of course, we're moving more towards the season that we would expect the flu season to be here. So we could see a convergence in the next, say, 8 to 10 weeks of a flu season and the coronavirus. And that may be an issue that the consequences are still to be determined. But I would strongly say, as New South Wales Health Minister, to our community, to our business community, think about all the things you can do. It's not just the basic steps of using hand washing as much as possible. It's not just about sneezing into our elbows. It's not just using appropriate tissues and disposable. It's also making sure that as employers, for example, you prepare for the possibility that you might need to have your staff working more from home. We might need to do a whole range of things. Now, we have, of course, sitting behind the everything that health does in New South Wales, we have a pandemic plan that is not been activated as such, but there are steps of that, there are parts of that that of course we're working on and looking at as to what might need to be implemented. And I'm going to ask Dr. Chant in a moment to speak to that, but it is important that we realise that we can, as a community, take steps to minimise the risks of transmission if and when that becomes an issue here in New South Wales. So I'm going to ask Dr. Chant whether she'd like to add to that, and then we'll take some questions on any specifics. Dr. Chant.
Thank you. Thank you, Minister. So New South Wales has both a whole of government and also as a health-specific pandemic plan, which was always developed with the anticipation that it would cover respiratory pathogens with pandemic potential, which is basically what the COVID-19 infection represents. Since the get-go, on the 21st of January, we stood up our Public Health Emergency Operations Centre and have been working with our colleagues in the States and the Commonwealth at gaining the best intelligence. We've been meeting daily to consider that intelligence, and as you can see overnight, new information comes to light each day. There's still a lot that we need to know about this virus, but we've learnt a lot over this period of time, and that stands us in good stead to inform our preparations going ahead. As the Minister referred to, whilst we are seeing a decline in the cases in the provinces outside the Hubei province in China, we are seeing growing evidence of cases in other countries that are not linked to travel from China, representing community spread in those countries. There are some characteristics of the virus that really mean it poses a difficult challenge in containing the spread. And that's because this disease is mild in many and severe in some. So we know that people are potentially infectious at the time around when they've got symptoms, but those symptoms might be quite mild, so they may actually not be thinking of the protective things they need to do at those times. And similarly, we know that it's actually quite infectious, so a little bit more infectious. It's got a reproductive rate of 2 or 3, and that means for every one person that's got it, if we don't do any other strategies, we get about 2 or 3 cases, and so that accounts for the exponential rise that you're seeing in some areas. I would like to assure the community that we are looking hard for any community transmission or community spread, and we haven't found it. We've done over 2,500 tests, and all bar 4 of those have come back as negative. We remain vigilant, and we have got enhanced surveillance systems to pick up and detect early any community spread. I'll leave it there, Minister.
Happy to take any questions to either me or to Dr. Chant.
Minister, under the plan,
Sorry, we'll go with Chris Mark because he's in the middle of the room. Oh, is he?
Trigger point, Chris?
Correct. Is there a trigger point for the pandemic, and to be called a pandemic? Is there a trigger point for that?
There are a number of factors which would be taken into account to determine whether or not it's a pandemic. But, and of course, the World Health Organization to date has been reluctant to do that. But the determination will be made by all states and territories through a particular structure with the federal government as to when that will be. As to the specifics, I'll ask Dr. Chant on the range of issues.
So we just go back to the definition of a pandemic. A pandemic is the emergence of a virus which can spread and impact on the community, for which the community has little or no immunity. A pandemic doesn't mean the severity, so you can actually have a mild pandemic or a virus that causes a mild impact, but it still meets a pandemic, and it has to be across multiple continents. Generally, the World Health Organization will declare a pandemic, but as you can see that whether it's declared or not, it is prudent, and that's reflected in all of our plans, both at a state level and a Commonwealth level, that as part of good emergency preparedness or pandemic planning, you actually do the preparation whilst you're dealing with containment. You're simultaneously looking at those scenarios that might emerge and planning for them. So, for instance, at this stage, we have started, already commenced, planning for a surge in respiratory presentations to our emergency department, noting that, as Minister indicated, we might end up having influenza coming at a time, peak time, as well as the COVID-19 infection. So we would anticipate we'd see more presentations to our emergency departments. We also might see more admissions to our ICU departments. So again, we're planning for surge for those, as well as general need for hospitalisations. We're also looking at critical supplies and making sure that we have those in place to support healthcare, as well as working across government agencies, because part of our role is to provide and support advice to the community through our agencies such as Transport, Families and Community Services, and that whole of government work has already commenced.
Minister, Victorian Health's telling people who've been to South Korea or Japan to self-quarantine for 14 days. Is the same advice applying to New South Wales?
I'll leave that to Dr. Chan at the moment, but can I just say this, that obviously these are very fluid times as we're getting more and more information coming from jurisdictions outside of Australia, and looking also at the increased likelihood of there being the possibility of transmission between people, although not having occurred here in Australia at the moment. We do have to look at that. Tomorrow we have a COAG health meeting where we will be looking at these issues on a national basis. My preference at the moment is to await the federal discussions tomorrow, but very alert to the fact that if there are people who have been exposed or believe they've been exposed, then they should actually be taking steps, sensible steps, and certainly the minimum period is 14 days of self-isolation. So if they have been in areas where they already know there's a likelihood, not just possibly South Korea, they should be thinking about doing that anyway. But I'll ask Dr. Chant whether she'd like to add anything to it.
Victorian Health is telling people Japan and South Korea, if they've travelled there, self-quarantine for 14 days. Is New South Wales not telling people that?
So it's very important that for consistency we work through national processes in giving national advice. The Communicable Disease Network Australia meet daily, as does the Australian Health Protection Principal Committee. So CDNA has got the infectious disease experts and virologists and others, as well, and then AHPCC's got experts as well as the Chief Health Officers of the states and the Commonwealth. I need to follow up that point because my current understanding of our recommendations is that we are recommending that obviously overseas travellers that are returning from China self-quarantine, isolate for 14 days. Anyone who's been a contact of a case of coronavirus needs to isolate for 14 days. And what we are encouraging is that anyone who is from any of those countries such as Iran, Italy, South Korea, Hong Kong or Indonesia also comes forward for testing should they develop any illness, because what we're trying to understand is the risk of transmission in those countries. So I'll have to do some further investigation before I answer that question. Thank you.
Have you heard at all of any instances of racial slurs happening in hospitals in New South Wales? The Victorian health departments had to deal with that in Victoria over the reports that there were parents were not wanting their children to be treated by doctors or nurses of Asian appearance, and so now they're talking about racial profiling in hospitals. Have there been any instances?
There have been no instances brought to my attention in New South Wales of that occurring, and I would certainly say as Health Minister that there is no basis whatsoever for any racial discrimination whatsoever.
Could I just
Dr. Chan?
draw that attention? We have been aware of some certainly racist comments that have been made in social media platforms, and I've released a video around addressing some of those issues and making it clear that it's not about a particular culture or identity. It's really around the risks associated with overseas travel, not the particular nationality or the cultural heritage of the particular group. We've also been aware of the impact it's had on some areas, and we've done proactive videos, and I've been out to Chatswood and other settings and Chinatown reassuring people that I have no problem walking freely in those settings and that people should be out and supporting the Chinese community at this time. In addition, we are aware that there's been to be put it frank, overreactions. And I think it's really important that people find the facts on our website, that people take the care to seek facts before acting, because when they take those actions, it has ripple effects. And so we've had people that are excluding potentially children from settings that are contacts of contacts, and so again, that misinformation then breeds increased anxiety. So I would caution people, if they have questions, please ring their public health unit. We'll circulate the number to you, but it really is important that we act cohesively as a community and take a very rational, sensible approach. There may be challenging times ahead, but it is important, and you have a key role as the media to keep people informed, but also informed with the facts. So thank you.
Can I just stress, sorry, before I do that, so what the Chief Medical Officer was saying in the broader community, but there's been no indication of that within our hospitals. I've heard nothing. I don't think she's heard anything. And I would say very clearly, ignorance is no excuse. People need to get to the facts, and the facts are that this is not specific to any particular racial group. It's a virus. It's a virus that could have occurred anywhere, and it will be handled as every other virus has been handled. At some point, this particular virus will be circulating in our community, just like, for example, now the H1N1 swine flu. Everybody got very concerned about swine flu. We managed it because we as a community came together, worldwide we came together, and that H1N1 now circulates as a regular virus through our community. It doesn't cause undue grief, and then there will be a point when exactly the same situation occurs. So understand that there should be absolutely no racial discrimination on this basis, and I'm very, very adamant about that. Chris was next, I think.
The focus that the chap was talking here about overseas travel.
Mm.
Does the state government have any upgraded view about overseas travel that you perhaps could take to COAG, just in a general sense about overseas travel?
So could I perhaps ask that? So as I said, I described those processes before where CDNA provides advice to AHPCC, the Australian Health Protection Principal Committee. We provide advice to government. So we provide advice around the DFAT advisory levels for the various countries, and we also consider and provide advice to the government around that is considered by the Commonwealth Government through its processes around the utility of border measures. Those discussions are had on a regular basis. We've been reviewing the advice provided on a weekly basis. That is often made public in terms of the AHPCC considerations. So it's very important we work through those processes and provide that advice to government.
Which means the short answer is not at this point, but we'll be taking advice from that committee that works right across the Commonwealth. Having said that, that committee makes the recommendations, and as I've said earlier, and as Dr. Chant said, it's desirable that our responses be on a national level, because obviously people can be passing from one state to another. Every now and then there might be a change to that. I mean, New South Wales led the country actually when we made that recommendation that children should be held back from school for 14 days. So whilst the government is taking that advice and tries to make sure that we deal with it on a national basis, there might be instances from time to time, but not at this point. Sorry, Lockie.
Be confident that regional hospitals and health facilities do have the equipment that will be required if the pandemic is declared. I know your Shadow Minister today has cited some concerns, particularly in his electorate around Wollongong.
I'll get Dr. Chan to answer that, but I think I'll leave Dr. Chan to do that.
So New South Wales is quite a large state. It's got a lot of rural regional, and we actually have quite a lot of intensive care unit capacity outside the Sydney metropolitan basin. That works in a networked way, and we also have retrieval services that are very highly qualified. And so the way in which we work is very much as a network. So the aim is that we ensure that there's equitable access to things like ICUs and high-level other care that might be required, such as ECMO.
Sorry, Minister, you're not willing to defend the regional hospitals and say that they will be able to cope with coronavirus?
Don't think anybody's asking about defending it.
Yeah, so I was just going to say regional hospitals can provide certain care, but the way we provide care is networked. So if there's a hospital, for instance, in rural regional where there is a person who will benefit from ECMO, we have retrieval services that go out there and retrieve them. Some of these services are not amenable to being done in small facilities because they require a lot of different skills that need to be brought together to do those procedures safely. And so the way we do that is the current way in which we treat severe trauma, complex oncology. We have a network system, and that is one of the strengths of the New South Wales health system.
So basically what you're saying is we could see, if this, worst case scenario, we could see mass patients being transported from...
No, because the reality is people are generally mild in many and severe in some, okay? So many of our regional ICU facilities can provide incredibly high quality ICU, equivalent to anything. There's no difference in the ICU, general ICU, but there are some particular techniques such as ECMO, where there is going to be fewer centres that provide that more high end. And so the way we achieve access to those techniques and procedures is by bringing them centrally. So we will be ensuring that there is adequate support for the regional ICUs as well. Now, there is also an issue around the numbers. So whilst rural regional have, the pandemic will often, if we do have community transmission of COVID-19, it often spreads slowly through the community, and rural regional in many circumstances can be spared for quite a while. And so we work as a system, and the whole principle of the New South Wales health system is to ensure that we've got equitable access to services across the board, and we will manage the system in that way.
And the details today, Minister, about the use of stadiums, for instance, quarantine facilities and the erection of temporary facilities near hospitals and so forth. What do we make of that?
Look, the pandemic plan has been in place for many years, and it's in a worst case scenario. But certainly from our point of view, you could reasonably anticipate that if the COVID-19, the coronavirus, does start transmitting person to person here in Australia, which is a possibility, then we would need to have, as the Chief Health Officer said, a surge in our capacity within, for example, ICUs and emergency departments. That may mean that we'll need to look at a whole range of facilities to support that effort. But at this point, it's all looking at a worst case scenario. I don't think that you need to be overly concerned about that at this point.
Perhaps.
Sorry, the Chief Medical Officer will say something, Kate. Sorry.
So sorry, we just wouldn't be anticipating the need to use those facilities with what we're facing in terms of the COVID-19. We that work of planning is being undertaken by our local health facilities, and clearly if we need to quarantine people, we would generally be quarantining people in their home or in other appropriate accommodation facilities. In terms of the need for clinical care, we currently have a number of surge plans in place, and that is what the local health districts are undertaking, that planning now. But they have planned for this in the past, as they did with the 2009 H1N1, and they will do this planning. They're undertaking this planning actively as we speak.
Can I also just stress, Chief Health Officer uses terms that sometimes we all don't understand, but things like ECMO, what she's really saying there is that there's a particular medical procedure, an extracorporeal membrane oxygenation, which occurs in very severe cases. And that's a very small group of people that would be anticipated to occur in. So, and that is possible. It requires very high-level intensivists to be ICU specialists to be able to do that process. It is possible in the regions, in our major regional hospitals, but obviously it's very available in a number of all of our major city hospitals. So I don't think that is any indication that we don't have capacity. We do. The plans are there, and we have the capacity. It's just that there's a small group of people who might need that extra service. Sorry, are you going to ask me something, Chris? Or sorry, Kate.
Emergency departments were already seeing record numbers of patients coming in, so it doesn't necessarily need to be worst case scenarios that emergency departments be overwhelmed.
Good question, Kate.
What are the surge methods? Are we going to use them?
Can I say as Health Minister to that? Our emergency departments in New South Wales are now seeing about 3 million people per year. Just 7 years ago, it was only 2 million people. Generally, our emergency departments are chockers. And I would say to people, whether it's any sort of virus, anything at all, not just the COVID-19, the coronavirus or anything else, or the flu, if you don't need to go to an emergency department, don't go. Because you are actually making sure that perhaps one of your family members or one of your friends won't be able to get into that emergency department. So go and see your GP. That's why GPs are there. Emergency department, emergency only.